Go. Good day, ladies and gentlemen. I'm Dr. Behgal once again, and I'm here to speak about the radiotherapy side effects. This is the part 2 of the video, and here we'll actually be showing some things which we can do. And as we all know, it's the ulcers and the skin reactions, mucositis, which we see with radiation, which are the main things which make people scared of radiotherapy. And chemoradiation, addition of chemotherapy to radiation, makes the blisters and the mucositis much more. And these days we see very little of that because of the steps and the technology available to us in radiation therapy, namely IGRT and IMRT, step and shoot, radiosurgery, X-knife, and the technology allows us to target the exact thing. But at the same time, as we all know, cancer, the symbol of the cancer is the crab, which has slender legs which make it spread. So we do have to target the normal tissues also. No matter how good the technology is and how good we're able to target, we will have to target the normal tissues as well. So this talk is mainly about the standard which our textbook Devita gives us in the salt form, what we can do, and very few people tend to use it. And I will just tell you what has been my own formulation, and it has worked very well. It prevents mucositis, it allows the patient to eat food properly, and makes the patient much more comfortable for mucosal or skin application. And now I'll be shifting from me to the these are the various products which we are using, and these are all the products we have. And of course we have the gloves to mix up everything. And in our hospital we've made a gargles mixture, and this we give to the patient to purchase and bring, and then our staff mixes it and compounds it. Now I'll explain everything. These look like quite a lot, but the actual cost is around 250 rupees. And firstly, each component has its own use. Now the first is xylocaine jelly. This is 2% xylocaine. Lignocaine hydrochloride, 2% jelly. 2 tubes are put, and we put this in an empty bottle, and an empty bottle of a PET bottle, or a Pepsi or a Coke, whichever bottle is available. Then sucralfate with oxycitazine. This may or may not be with the oxytocin, because we are already adding the xylocaine. The xylocaine is basically a local anesthetic. The mucus doesn't hurt. Sucralfate sticks to the mucosa, protects it, reduces the pain. Mucaine gel is again an antacid, and its effects act like the antacid, and they stick to the mucus, the oral mucosa or the throat. Benadryl we are adding for its anti-allergic and antihistaminic properties. Diphenhydramine. Bromexine to reduce the expectoration. Glycerine to make it a sticky affair, to make it sticky so that everything sticks. Clotrimazole topical solution, 2 bottles, and these are an antifungal property. Xyloric, the breaking up cells, the uric acid they release is not toxic while we are giving radiation or chemoradiation, and this mixture is helpful during chemotherapy also. Tetracycline capsules, we open them and put the powder into the mixture. 4 capsules. This is all I'm telling you for 1 liter. 10 tablets of 0.5 mg dexamethasone. You can increase the dose of the steroid also. Dexamethasone has a benefit of being soluble in water. 20 tablets of Disprin. This is an anti-inflammatory action. And what is optional is the filgrastim, the GCSF. I'm sorry, I'm not promoting any company or anything, but this is all we had right now. Granulocyte colony stimulating factor. This helps the new cell formation, and this comes in a pre-filled form. It's in a pre-filled syringe, and any oncology center would know how to use it. And this is put into the mixture. It's costly, around 1000 rupees. We charge around 300-400 rupees for this vial, for this injection. That's the wholesale price. And this is optional to the mixture, and we put it only when the mucositis is too much. And this is how we formulate the mixture. And our staff are able to, the oncology nurses and the OT staff are able to make a mixture. So 1 or 2 depending on the amount of mucositis. And this is the entire thing. Xylocaine for local anesthetic property. Sucralfate to heal it, forms a coating. The mucain gel as an antacid reduces the acidity, the pH of the whole mixture of the saliva. Benadryl, antihistaminic property. Bromexin to make the secretion thinner, to make it stickier, the glycerine. Antifungal, antitoxicity from the uric acid. Antibiotic, tetracycline. These both are soluble. This we have to open the capsule and put in. And the final end product is looks something like this. This is about half a bottle. We took it from a patient. It comes up to this volume. This much I have shown you. And if it doesn't come up to 1 liter, this much, we put in as much water. And this should be done around 8 to 9 times per day, so that there is minimal toxicity. And believe me, this is really helpful. And all of it can be swallowed also. So normally we tell patients to take 1 capsule, rinse the mouth, gargle, spit it out, then rinse, gargle and swallow. It helps in esophagus carcinomas, oral cancers, GA cancers, and sometimes in some cases we put it on the skin also. It's quite helpful. In those cases we can put GV paint, we can add to that. And there are some drugs like 5-FU, methotrexate, Tegafur, which cause mucositis of the GA. There also it's helpful, even if you're not giving radiation. But this is really helpful for radiation, during radiation and after radiation, to prevent and to cure the ulcers caused by radiation, which are due to radiation. And don't think that you're getting the best kind of radiation, IGRT or SRS, so you won't get mucositis. You want good results, a tonsil or a tongue, even if you're getting IGRT there will be nodes which have to have these nodes, level 3 nodes, level 4, 5, 6 nodes. They're all going to be radiated. So every node will be radiated. There will be side effects. The throat will get a dose. So this mixture is very important. You want good radiation, you want to cure the disease, you're going to give the entire loco-regional area radiation. So which means every part of the oral mucosa is going to get some dose. Thank you very much. See you later. And